This is an ABC podcast.
Australia has been one of the world's leading nations in the prevention and prompt treatment of heart attacks, a blockage of blood to a segment of heart muscle. Deaths from heart attacks have fallen at a rate of about 2% per annum for many years, which adds up to a lot of lives saved. But even so, heart disease remains a huge killer, and having had one heart attack puts a person at risk of both heart failure and another heart attack, not to mention other problems. So the healthcare system might be terrific at getting you home in good shape, but what happens over the next few years? Who does well and who doesn't? Turns out it's not a question we're very good at answering. We're pretty lousy at long-term follow-up, and we've had to rely on overseas statistics until now. New research has brought together data from every Australian state and territory, as well as New Zealand, to analyse 7-year survival rates for men and women who've had a heart attack. Dr. Bora Ledlachki from the Lyell McEwen Hospital in Adelaide is one of the study's authors. Welcome to the Health Report, Bora.
Thank you for having me. It's good to be here.
So tell us about the study.
So this study is really exciting because it's a first of its kind here in Australia. It's population-wide, so we're not worrying about generalizing. We have everyone. We looked at people with heart attacks from 2009 to 2015, getting a very large contemporary cohort. And we looked at primarily survival over 7 years. So we knew a lot about short-term outcomes, but we wanted to give patients and clinicians more knowledge on what happens.
So this is a record linkage study where you're linking the records from hospital through to the rest of their medical care.
Exactly. So this is data that's already there. We routinely collect hospital data, but it seems that no one has been using it, and we've linked it to death registry data to be able to do this study.
So what did you find?
I think the primary takeaway from this is that we're actually doing fairly well. So survival over 7 years is just above 60%, which when you compare internationally is on par to the best, which tends to be Scandinavia. And in fact, we're doing better than our Western comparisons of the US and the UK.
So an average hides a lot. Some people are going to be doing really well and some people are not. Who did well and who didn't?
Yeah, exactly. So I guess the most exciting part is that those up to the age of 64 and those that ended up getting the procedure that opens up your coronaries or revascularization did really well. So they tended to be above 85% survival.
So when you say reopening, you're talking about either a stent or a bypass graft?
Exactly.
And was there any difference between the two? There's a lot of debate that sometimes bypass grafts give you a longer survival than stents and vice versa.
There is a lot of debate, but I guess that question has been addressed in several trials and depends on the type of lesion you have and also the amount of lesions you have. So I think both of them have a place, and there wasn't much of a significant difference. It seemed that maybe CABG was a little bit better.
That's the bypass graft.
Yeah, the bypass.
Now, age is probably the strongest risk factor for a heart attack, so it's fine saying we're doing terrifically under 64. What about over 64? Because that's the bulk of people who are having a heart attack.
Yeah, that's exactly it. I think that's where we have room for improvement. So specifically looking at, I guess, the worst age category, so above 85 years of age, these patients are not doing well. The survival is less than 18%. And it's kind of just a downwards decrease in survival as we go up in age.
Now, what about one of the things that should happen but doesn't always happen is that you get put on blood pressure lowering drugs, beta blockers, you get put on aspirin, you get put on statins, but not everybody gets those. Was there a relationship to survival as to how well you were treated after the heart attack? Because sometimes cardiologists wipe their hands and say, I've done the stent, goodbye.
Yeah, you're right. Unfortunately, one of the limitations of this data is that we couldn't really capture the uptake of medications per se, but we do have data from colleagues both in New Zealand and Australia that have shown steady increases in these over time, and this is, I guess, speculated to be the reason that we see such a good survival.
It's well known. It's well known in heart disease that women are neglected, to be blunt. They're undertreated, poorly diagnosed. Sometimes it's because they present late because they've sorted everybody else out in the family before they turn up at the emergency department. Mm-hmm. How did women fare in the long term compared to men?
Well, yeah, you're right. So not only do women present later, but I think there is a medical bias often towards women. And it's well known that, especially in the short term, women do worse. But the data on the long term has been quite unclear. And what we found is that there is an increased risk, a clear increased risk for females. So we need to figure out what is causing this. And it's going to be the topic of future studies.
So what do you know is the low-hanging fruit in terms of improving survival over 7 years in women, older people, and so on, from what you've found so far?
So with women, it's a difficult question. I think we need to look into that more, and it'll be very interesting to see what treatment rates are in terms of that population. But for older people and those with multiple comorbidities, it seems that we are under-treating them currently with revascularization. Now, it's tough to say whether it's those conditions that then put them at a higher risk of harm during the treatment, but I think it's important to ask the question because thus far we've been excluding older people and people with comorbidities from clinical trials.
Dr. Bora Nadlatsky is at the Lyle McEwen Hospital in Adelaide.